like we had in the heart, we have bags that the lungs are contained in within the pleural cavities. And again, just like with the heart, we have a visceral layer and a parietal layer. So again, it's kind of like the fist in the balloon concept, where it's a double layered membrane, and the layer that is attached directly to the lung is called the visceral pleura, and then the parietal pleura is fused with the underside of the rib cage. So when your ribs expand and they pull this parietal pleura, there is serous fluid in between the two layers in what's called the pleural cavity. And so it allows for the visceral pleura to be pulled along with the parietal pleura, which then causes the lungs to expand because that visceral pleura is attached to the lung tissue. So the lungs themselves don't have any muscle in them. It is the action of the rib cage and the diaphragm that's going to cause expansion of the lungs. So down here, again, is the diaphragm. So know this picture here for the different layers of the linings of the lungs. So now let's just look at the anatomy of the lung really quick. So this is the right lung and this is the left lung. This view is actually if you were looking down your armpit on lateral side of your thoracic cage. And this part right here is facing the outside. And this view is what's facing the inside, facing toward the heart. So the lungs sit a little bit more off into our kind of our armpits than we think they do. And they sit a lot higher than people think. Just below the level of your collarbone, we have the top part of the lung, which is called the apex. And then the bottom of the lung is called the base. And like I said before, the right lung has 3 lobes and the left lung has 2. The left lung has a spot carved out for the heart called a cardiac notch. If you remember, the heart goes off to the left a little bit. So there are some divisions that you need to know. So this is the superior lobe, that's easy. And then both sides of the lungs have an inferior lobe, but the right lung has an additional middle lobe. So the lines between them, between the superior and the middle lobe, we have the horizontal fissure, and that's only on the right lung. And then on both the right and the left lung, we have the oblique fissure, and it's going in the oblique plane. So looking at the other side here, this area, this box area right here, is called the hilum. And it's basically like where it's the freeway system of the lungs. It's where everything's coming in and out of the lungs. So within the hilum, we have the primary bronchi on both sides, the pulmonary arteries, and then the pulmonary veins. So again, the hilum is just an area of the lungs where structures are coming in and out of the lungs. And there's also going to be some lymph vessels in there, but you just need to know the pulmonary bronchi, the veins, and the arteries. So this is our model of our lungs, and you might see a different one on the quiz, but it's pretty similar. Again, you've got the 3 lobes on the right, the 2 on the left. This weird looking thing down here is the diaphragm. So I think I did notice that was a quiz question. It's kind of goofy looking, but that down here, that is the diaphragm.